Hello and welcome to Community Health Journal. We begin today with an effort underway to increase the supply of family physicians in Eastern Washington. Kadlec Regional Medical Center is working to become part of the University of Washington's highly regarded family residency network. The effort requires financial support from the legislature, but Kadlec leaders believe it will pay off many times over in its benefits to patients in our area. During a three-day tour of higher education programs in Walla Walla, Yakima, and the Tri-Cities, Kadlec leaders told legislators they are poised to begin training family medicine residents, but it will take a financial commitment from the state to get the program launched. Kadlec's interest lies in helping bolster the critically needed supply of family physicians in underserved areas around the state, especially in Eastern Washington.
Residency slots per 100,000 population, and U.S. is 35.7, Western Washington is 29.8, so even Seattle is behind the curve in the Northwest, and Eastern Washington is 6.8. So that's what we're struggling with. We import, virtually every physician that we have is imported from, almost always from outside of Washington. Occasionally we get somebody from UW. Our rural hospitals have even greater challenges than we do. We're here to serve the entire state and the eastern part of the state, and we think it's our responsibility to work with you folks to train residents.
Members of the Higher Ed Committee heard that the University of Washington has been working closely with Kadlec for a few years to develop a UW family residency program in the Tri-Cities. The partnership takes a significant commitment of time and money to get started. That's where investment from the state comes in to help make it happen.
What you see when you leave Olympia and bring the committee out on the road is the enormous creativity that every one of our colleges and universities is investing in its community and how involved the community is in the educational process. So when you visit Kadlec and you see their relationship with the university and the colleges, you really see how live that relationship between teaching and delivering healthcare services in the community is.
And specifically about the effort to bring a residency program to the Tri-Cities, in your eyes, is it something that needs to be done?
Oh, of course. No, it's absolutely essential. We tried last time. We ran into a couple of legislative roadblocks, but we all know that we are way underserved in our rural communities with general practice, family practice physicians, nurses, PAs. We know we've got to increase that. And the faster that we can get these residencies, start producing more physicians here in rural areas, better off we'll be.
We're going to be bumping into some very serious problems if we don't get some residency program established here and getting the residents who do go through the program here, staying here. It's been proven that those doctors who have gone through a residency program in a community usually stay in that community or in that region. So it's vital. We need to get more health care delivered to our residents in this area. This is a growing region, as well as the Tri-Cities is growing also.
If all goes well, Kadlec hopes to welcome its first family medicine residents in the fall of 2015.